Welcome to the August summary of ecancer's contents. I'm Gordon McVie, I'm the editor. 3 prognostic factors, predictive markers if you like, to start with. The first is Gauchal, a joint effort between the Karolinska in Stockholm, Uppsala and King's College London. Study of this wonderful population database that Swedish epidemiologists have exploited to the fore. And they studied 206,000 individuals to look for commonly used biochemical tests as potential prognostic factors for male cancers in penis and testicular tumours. They looked at C-reactive protein, albumin, haptoglobin, things that are commonly measured in the biochemistry lab. There were a substantial number of cases of both tumours in the study, and the bottom line is that these 3 markers were unhelpful. The second predictive study, which we feature in this month's eCancer, is from Herrera Vicente and her colleagues in Valencia, in Spain. And it's a nice study of patients with triple-negative breast cancer who receive neoadjuvant chemotherapy, typically taxanes, anthracyclines, and then surgery. And they looked for a number of prognostic factors which would correlate with the complete remission status or near complete remission status thanks to the neoadjuvant chemotherapy. And they came up with one factor which was positive with a univariate and multivariate analysis, and that's tumor-infiltrating lymphocytes. We've had a great deal about tumor-infiltrating lymphocytes from the immuno-oncologists over the last couple of years, since it was clear that the more lymphocytes you have in a cancer, it seems the more likely you are to get a good result from the immune oncology drugs and vaccines and various maneuvers. And it turns out that in common or garden chemotherapy, lymphocytes are important too. And then the third predictive study comes from India, gallbladder cancer. Curious cancer, very high incidence in North India and in Chile. And this is a study from Sharma and his colleagues in Lucknow, and they have looked at a number of genetic mutations and looking to see if there's some sort of link between particular KRAS, I think 3 types they looked at, and PIK they looked at, and they looked at the EGFR. They found that exon 20 EGFR and the PIK3CA were mutated in 20 to 25% of the tissues from patients with gallbladder cancer. And they found that on exon 1 KRAS was equally helpful in terms of predicting the disease and maybe eventually giving some sort of clue as to etiology. And then we turn to 2 case reports plus supporting literature reference. The first is from Javier Soteldo from Caracas in Venezuela, war-torn part of the world. And he has reported on pleomorphic adenomas of the parotid and pointed out that some of these are metastatic, despite the fact that the WHO classifies them as benign cancers. And then the second paper comes from Egypt, and this is not an observational study, this is a therapeutic study, a surgical technique. 2 patients with GIST of the rectum have been described by Eldam Shetty from Mansoura in Egypt, and he describes a new technique for operating on these rectal cancers, often large rectal cancers. We're highlighting 2 videos this month. One is interesting introduction for lay oncologists and others about the use of PET, and that comes from the new PET unit in Cardiff under Professor Chris Marshall. This is the first of a number of videos which we'll be making with Cardiff over the uses of PET and the indications over the next few months. The second video is about patient-doctor interactions and how essentially to improve these, not difficult to improve on what we do, because what we do at the moment is pretty awful. And despite the fact that there are courses available for doctors to learn how, for instance, to deliver bad news, they are frequently unattended. Doris Schmidt and Christine Clapp have produced a really nice video which we have great pleasure in promoting. It's to be found at breastcancervision.com, and it shows a number of hints for doctors who are uncomfortable in the situation of discussing bad news with patients and their relatives. There's also an editorial this month which I think is unusual, and it is written by a patient with breast cancer who has developed a charity in France called Breast Density Matters. Her name is Cheryl Cruis, and she has reviewed the literature from a patient's point of view, picked up things that she understood, but in fact she's covered all the relative and important literature which shows that breast density on mammography is indeed an important prognostic sign. Something like 17-fold increase in risk of getting eventual breast cancer if women have got high density breasts on mammography. Two reasons. One is there seems to be a biological reason that these breasts are more prone to develop into cancer, but also there is a technological problem in that small breast cancers can be completely camouflaged by the density which it picks up on the mammogram. And lastly, I'd like to remind you that we've got 20 superb modules in our teaching section, e-learning. Press the button and you'll get into several hundred really important education modules. One of the first was supported by the Atomic Energy Commission in Vienna, and this is 20 modules on palliative care and how to do it in sub-Saharan Africa. Several countries in sub-Saharan Africa still don't have a single radiotherapy machine, and several of them also ban the import of opiates like heroin and morphine. So if you really want to know how to deliver best palliative care without those first world technologies, radiation therapy and opiates, then this is a must. These modules have been seen by 2,000 doctors and healthcare professionals already, and they are very well worth revisiting, especially if you're new to the topic of palliative care. Speak to you again next month.